Thank you for the opportunity to present our project on the impact of systemic inflammation on CPET results in oncology patients. Both cardiopulmonary-derived measures of fitness and preoperative systemic inflammation are associated with postoperative complications following major abdominal surgery. Systemic inflammation plays a major role in the development of cardiovascular disease. Mediators of systemic inflammation directly injure cardiomyocytes and modulate their response to damage, contributing to postoperative myocardial injury. We are aiming to characterize how the pro-inflammatory phenotype can affect aerobic fitness and whether it can be used to predict worse postoperative outcomes. We reviewed perioperative elective data for oncology patients recruited for PQUIP for a single NHS trust over 18 months. The data from a total of 50 cancer patients undergoing major abdominal surgery was investigated. We used neutrophil lymphocyte ratio more than 4 on the day of the CPET to identify patients with systemic inflammation. In the whole group, mean plus minus standard deviation of NLR was 3.4 plus minus 2.95. 10 patients, that's 20%, had an NLR of more than 4 on the day of CPET. Table 1 demonstrates patient demographics, CPET parameters and postoperative complications between those patients with NLR less than 4 and more than 4. Presence of diabetes was associated with significantly higher NLR and associated with significantly decreased maximum heart rate and VO2 peak. No impact was seen on postoperative complications, although this may simply reflect a type 2 error. Previous smoking history was associated with significant increase in surgical site infections. P was 0.022, which is to be expected. In this cohort, there was no association between NLR more than 4 and CPET parameters, nor postoperative complication. NLR is a continuous variable, but papers showing association with worse perioperative outcomes use a cutoff of NLR more than 4. As such, we performed linear regression to assess whether there was an association between NLR and various CPET parameters, including anaerobic threshold, maximum oxygen pulse, VO2 peak, and VE over VCO2. Now, our study was limited by sample size and a number of confounding factors that could influence inflammatory mechanisms, in particular diabetes and metastatic disease. Elsewhere, there is growing evidence that a subclinical inflammation phenotype may be linked with poorer postoperative outcomes, and the use of NLR could prove to be an inexpensive and readily available marker of this, and could inform perioperative risk management. As such, we are continuing to collect more data. Thank you.